Hospitals around the nation are hurting financially with the lack of revenue from elective surgeries. One of those hospitals being MCH right here in Odessa. So as a result, they have furloughed some of their employees in order to make ends meet. Big 2's Felice Romero has our details. Felice.
The spokesperson for MCH tells us that they did everything they could to work with people and rearrange schedules, but unfortunately they did have to lay off about 55 workers. People are continuing to feel the financial impact due to COVID-19, and hospitals are no exception.
The financial situation most hospitals around the country are in right now, with the governor's decree to basically shut down any elective surgeries. That's a big revenue stream for a lot of hospitals. We've had to make that tough decision to furlough non-patient facing employees.
But what counts as a non-patient facing employee? According to MCH, they're employees that are not directly dealing with patients and areas of the hospital where patient volume has dropped to zero.
None of those people that are dealing directly with this pandemic are being affected by those furloughs.
Tankers Lee says they were able to lessen the hours of some employees and redirect others to other departments. But those who were furloughed were offered benefits.
And any employee who is furloughed right now are being given direct information on how to go to apply for unemployment benefits. Now, the ultimate decision on whether they get unemployment benefits or how much they get is obviously up to the Texas Workforce Commission. At this time, Medical Center Health System is still paying the employer portion of health, dental, and vision insurance during the furlough.
More hospitals in the Permian Basin are unfortunately in the same situation. For more on that, tune in later on this week. Reporting in Odessa, I'm Felice Romero.